Greetings from the BioStock studio here at the Medicon Village in Lund. Today we're happy to welcome Jason Amello, Chief Financial Officer at Saniona, who joins us via link from Boston in the US. Jason, a biotech industry veteran, was appointed as CFO by Saniona last year when the company began establishing a larger US presence. He's here to tell us more about his background, his current work at Saniona, and his vision for the company moving forward. Welcome, Jason.
Thank you, Michael. Thanks for having me.
Could you please start out by telling us about your professional background?
Sure, happy to. So I've been in finance for in excess of 30 years. The majority of that has been in biotech. Although I didn't start in biotech, I started in the consulting industry. I worked for Deloitte for 10 plus years. After about 10 years, I realized I wanted to be on the inside of a company and not on the outside advising. So that's when I got my first inroads into the biotechnology industry, and I joined Genzyme Corporation, a very large biotech company in Boston. I joined there, and I was head of the Strategic Financial Services Group, which was a group that advised on all of Genzyme's mergers and acquisitions, strategic transactions, partnerships, licenses, joint ventures, all of those things. And I was also Chief Accounting Officer for the company as well. And I was with the company for 11 years. And then in year 11, the company got acquired by Sanofi. And at that time, I moved on to become CFO of a public cancer company in Boston. And then after that, I joined a chronic kidney disease company in Boston also that needed to do a very large phase 3 study involving almost 8,000 patients, which is incredibly large for a small biotech company. So to finance that, I took that company public on the US exchange and raised almost $1 billion to finance that trial over a 7-year period. And then that trial finally finished after 7 years. At that time, I was starting to talk with Rami about all the great things happening over at Saniona. And I found it very interesting, and not just interesting. I thought I could also help and make a difference. So I decided to join.
Yeah, so actually that's a perfect segue for my next question, which is what attracted you specifically to Saniona, and what have been your impressions of the company so far?
Yeah. So Saniona has some really compelling science and has a tremendous potential to add value, create value for patients who don't have any therapies, and then also create value for shareholders. And, you know, as was announced back in 2020, the company initiated a strategy to refocus its mission from being solely a research organization to being a clinically developed clinical organization. Focused on the U.S. in rare disease, while at the same time leveraging its legacy and its talent around ion channel discovery, and then exploiting both of those opportunities so that we would focus on rare disease, but then also out-license some of the other molecules that may be suited for larger therapeutic areas. And as I mentioned, with the company going through a transformation like that, you know, most of my career has been spent building and growing biotechnology companies. I have tremendous experience in finance, the capital markets, fundraising, business development, and I figured those things could be very helpful for Saniona. So I couldn't think of a better time, really, to join the company. And right now, it's been exciting to be part of that transformation in action. Under Rami's leadership as the CEO, he assembled a very, very strong executive team because he was rebuilding the whole team. And that started with our founder, Göran Dreyer, becoming the Chief Scientific Officer and leading that whole development clinical research pathway for the company. And then followed by Rudy Baumgartner as the Chief Medical Officer. And then in a very concise period of time, Rami hired the balance of the executive team. I, for one, have only been here for 6 months, and the balance of the team has been even less than that. But it does feel like we've been working together for years already. It's a very strong, experienced team, very collaborative, not only just cross-functionally, but even cross-country with our colleagues in Denmark, whom unfortunately many of us have not even met in person at all since we've joined the company. And so we're all really looking forward to that day when we can do that. So needless to say, I'm very, very confident in our ability as an executive team to execute on this vision.
When you were hired, CEO Rami Levine said that you would be instrumental in the future financial ambitions for Saniona. What will your strategies be to secure capital for the remaining development stages in hypothalamic obesity and Prader-Willi syndrome?
Yeah, sure. It's a good question. Well, fortunately today, I mean, unlike a lot of biotechs, we are very well funded to be as a small biotech company with the $65 million US raise that was done back in August, coupled with our current cash resources. We're well funded into the second half of 2022, which is a very long runway for a small biotech. That allows us to advance Testament into its phase 2B trials and two indications, PWS and HO. And equally as important, it allows us to actually expand and advance our preclinical molecules into the clinic. So we have a couple of molecules that will be entering the clinic during that time. And then lastly, it also allows us to build out our US headquarters and our US presence, which is very important for the company's strategy going forward. The most important thing to remember from a financing perspective is that biotech is a marathon. It's not a sprint. It's very capital intensive industry. Even after these phase 2 trials that we do, the phase 2B trials, we will still need to do phase 3 trials on the same indications. And then we still have our pipeline that we still want to invest in. So it's a long journey to get to the development through commercialization. So for us, from a finance perspective, the most important thing that we do is to execute on our vision, advance these programs, and then build value by doing that. And if we do that, more capital will be available to us because investors would want to invest in that progress. So that's exactly what we're going to do. We're executing on the vision, advancing the programs, building value, while at the same time meeting with investors, analysts, banks, other external parties to ensure that the Saniona story and opportunity is well understood. And that's one of the reasons why we indicated not too long ago that we would be considering a U.S. listing to list the shares in the U.S. to provide a broader access and visibility of the company in the U.S., which has the largest healthcare investor base.
Yeah, and I'm glad you mentioned that, and because I wanted to ask, when will that happen, the U.S. listing? When will it happen? What will it look like exactly?
So we haven't really talked about timing. We're still evaluating the best way of doing that and when and with what structure. So investors shouldn't expect anything imminently at the moment, and we'll certainly communicate when the time's appropriate. So that right now we're just still evaluating, and in the meantime, we're making sure we have all the preparations in place so that when we do get to that point, we are ready. So that includes making sure operationally we have all our internal processes and capabilities at the right stage to do that listing. And then recently we just announced with our year-end report, financial report, that we restated the previous financial statements and had those re-audited to be in compliance with U.S. requirements, so that when we're ready to do a listing, that those financial statements would be ready to go. So that was just recently announced. As far as the structure goes, we're still evaluating what the listing would look like. There's different ways of actually listing your shares in the U.S. You can actually just do a straight listing and just list the shares with no financing. That would be considered a direct listing. There's ways of doing it with a financing, which would be equivalent to an IPO. But the important thing to remember too is the last financing that we did, which was a private placement that's marketed to a very small concentrated group of investors, and I know we had a large discount on that. When you're doing a public financing, it's a fully marketed deal to the large community of healthcare investors, almost all the investors in the world, particularly in the U.S. And so those discounts tend to be much smaller than private placements in general.
Mm-hmm. You mentioned the most recent private placement, and I just wanted to address some of the let's say critiques that have come out from there, and one of them is that some retail shareholders have stated that they were unhappy at the discount of this offering, and I just wanted to get your opinion on that.
Yeah, so I guess first off, what's important to remember is the criticality of the financing that was done. I mean, that was essential for the company to advance to the next stage. It needed to get into a phase 2B trials for two indications in rare disease. Um, the company would never be able to do that without that financing. The financings that were done in the past were much smaller financings, more in line with a research preclinical organization. But when you're late stage in the clinic, the needs, the financial needs, are significantly higher. So the company would never been able to do that. Never would have been able to advance even the preclinical assets. It never would have been able to establish a presence in the U.S. So that was essential. Um, and for us, this is the beginning of having access to broader capital and healthcare institutions. So it was also our inroads into getting in with those U.S. investors, very reputable investors. So we did that transaction with the best investors on the best terms at the time. And again, we're looking to do potentially a U.S. listing, and as I mentioned, those discounts tend to be smaller.
Yeah, so I actually wanted to bring up another decision that was criticized by retail shareholders in the stock option program that was approved at the October 2020 extraordinary general meeting. Just wanted to get your opinion on that.
Yeah, investors know, because we disclosed this many times as part of our overall strategies. Beginning of 2020, the company has initiated a strategy to transform the company from a research organization to a clinical development organization, by which with key objectives of being a U.S. fully integrated discovery, clinical development, and commercial organization focused on rare diseases, and then also being able to leverage its heritage pipeline of ion channel candidates by partnering those with larger indications. So as you focus on the U.S., you have U.S. investors, you have U.S. patients, physicians. It's where we're going to run our clinical trials. It's where we're going to seek our first approval. So when you're looking at the U.S., you need to attract talent in the U.S. to do all those things. It's very hard to do that as a foreign company when everything that you're doing is going to be in the U.S. So in order to do that, you have to attract talent in the U.S. with competitive packages that compete in the U.S. and biotech in the United States, and particularly in Boston. It's the biotech capital of the world. So the competition is immense. Employees have many choices as to where to go. And these are the packages that are offered to them, and we have to be competitive to do that. I know that some investors were concerned or questioned why the program was launched or approved when the stock price was low. The truth is, we can't pause our operations based on where the stock price is. We have to do everything with a sense of urgency. If you imagine businesses stopping and starting every single time based on where the stock price is, your progress would be, pretty much void. So we needed to just act with a sense of urgency. We have patients waiting for these therapies who have no options for these therapies. We have patent protection on our molecules, and on the other side of that is competition. So we have to be mindful of timing with all of these things. And unfortunately, stock prices don't always align with business objectives. So we have to act and go at the time we have to go. We always want it to be higher, but obviously we have to just run the business, and hopefully the stock price will follow.
Yeah, thanks for sharing that. And just to wrap things up, what can we see from Saniona this year, and where do you see the company in just a few years?
Yeah. So we have several milestones even this year. So we'll be initiating the phase 2B trials in both PWS and HO. That should occur the first half of this year. Also, the first half of this year, we'll be initiating a phase 1 trial in our one of our ion channel molecules, SON711. So that'll start a phase 1 trial. On the bigger picture, about when you're looking 2 years out, we are going to continue to advance both of those molecules into further clinical development. And we're looking to exploit even more of our ion channel candidates from our discovery engine that is led by Aaron Dreyer. He's Chief Scientific Officer. And under his leadership, we've had in excess of 20,000 compounds developed. So we're looking to actually expand those as well into the clinic. Bigger picture, long term, for the potential for Saniona is to expand our U.S. footprint. As I mentioned, we're running the trials in the U.S. Our physicians and patients, the largest rare disease need is in the U.S. So we will continue to expand that presence as well. And then even beyond that jurisdiction, we want to go broader within the world and expand our regulatory footprint in other countries and markets to make sure that Tesomet can be available for all patients for either PWS or HO. So we got a lot to do, but we're making great progress and looking forward to keeping everyone posted on how we're doing.
Yeah, we're looking forward to following all that. And but just to finalize, is there anything you would like to add?
No, very excited to be here. I think maybe for our certain investors that may own our warrants in our TO3 series, I just wanted to remind everyone that that will be expiring soon, and they will need to exercise those somewhere between April 6th and April 20th. So I just wanted to make that on people's radar.
Well, great. Well, thanks so much again for joining us today, and we do wish you all the best for your continued work at Saniona.
Thanks, Michael. Appreciate it.